Hey there everybody, Travis Kern here with Root and Branch Chinese Medicine in Portland, Oregon. Talking to you guys a little bit today on my way into work as usual. Today I wanted to take a minute to talk a little bit about acupuncture and how acupuncture works. So, normally on this talk we have a lot of information about herbal medicine and Chinese medicine generally. But lately I've been getting lots of questions, both from patients and prospective patients, about acupuncture. How does it work? How does it work? How does it work? How does it work? And any acupuncturist, any Chinese medicine practitioner out there gets this question. We are prepped in school even, hey, you're going to get this question. How are you going to answer this question? And the reason that it's not just a straightforward, this is how it works, is twofold. Firstly, the way that acupuncture works from a Chinese medicine point of view relies on language and one might say jargon that's specific to the way that Chinese medicine views the body, specific to the tools that we use to diagnose illness. And so if someone asks me, how does acupuncture work, and they're a Chinese medicine person or a Chinese medicine student, I can say to them, well, acupuncture works by moving qi, blood, and body fluids throughout the body's channels in an effort to restore balance and increase organ function, right? Which, to anybody who's studied Chinese medicine, that's just like saying that the sun rises in the morning. I mean, it's just a basic statement of function. But the thing is that qi, blood, and body fluids are components, essential components, along with essence or jing, to the Chinese medicine diagnostic world. But if you don't have a background in that, what are we talking about? Well, there are two mechanisms of action that have been relatively well demonstrated in the biomedical world. And I say relatively well because it's certainly not definitive. There has not been an observed definitive mechanism by which acupuncture works, which has led to many critics of Chinese medicine saying like, well, it doesn't really work, it's just placebo, it doesn't perform better than placebo, et cetera, et cetera. And, look, we can talk about the placebo thing in a minute, but let's lay out at least the most likely biomedical explanations for why acupuncture works. So keep in mind that acupuncture inserts a filiform needle, meaning it's a solid piece of surgical steel. It doesn't have a hole in it. It's not a hypodermic needle, meaning it's inserted below the skin with the purpose of injecting something, right? So it's a solid needle. It's very, very thin, about the size of, a dog's whisker, a cat's whisker, pliable, small. The insertion of that filiform needle into a location in the body has one of two potentially observed biomedical effects. The first explains why sticking needles in a place that hurts could help. So for example, you have knee pain, your acupuncturist finds spots on the knee that correspond to acupuncture points, or they're tender spots on the knee. Insert the needle, do some stimulation usually, take the needle out, and then the knee starts to feel better. How does that work? Well, the insertion of the needle into a portion of the body recognizes that a foreign object has been inserted into the body in a place that, according to the body's systems, there shouldn't be a foreign object. So the body responds by sending, immune system responses to it. So you're getting white blood cells, you're getting different immunocells responding to that area, blood, fluids, all flowing in an area that there previously wasn't anything flowing to. Consequently, the body's like, hey, there's this foreign object in here, we should respond. Oh, and hey, while we're here, what's all this junk, right? There's a bunch of, metabolic waste, a bunch of, old, dead, unfunctioning cells. Maybe there's some bacteria, some things we got to handle. So by responding to the foreign object, the body also coincidentally responds to the other waste products that are in the area around where that needle is inserted. And that might help to explain why the body can actually reduce inflammation and clean up waste products in a localized area where needles are inserted. The other explanation helps to talk about why acupuncture might work distally, meaning not in the area where it hurts. So that is to say, if your knee is hurting, an acupuncturist using a different style of acupuncture might needle your elbow, right? And they'll put needles in your elbow and have you move your knee around, and as you move your knee, they'll stimulate the needles in your elbow, and then lo and behold, your knee doesn't hurt anymore. Well, how does that work? Well, acupuncture points tend to correspond, not always, but they tend to correspond anatomically with nerves, large nerves, or bundles of nerves at particular locations in the body. And so by putting the needle there near the nerve and stimulating the tissue in and around that nerve, it's postulated that we're changing the way that that nerve, and therefore the nervous system at large and your brain, manages inputs. And since pain is an input managed by the nervous system, by stimulating those nerves and nerve bundles, we're actually changing the way that the body processes pain inputs. There's even some mild evidence to suggest that we can change neurochemical output, changing serotonin production and other markers that help manage pain or relieve pain in that case. And so maybe that's an explanation. So like I said, these are postulated, guessed at explanations. There's some evidence to suggest that they might be onto something. But from my point of view, and from the point of view of many people, including biomedical folks, the explanation is unsatisfying and not well proven. So then people say, well, if I don't know how it works, then it probably can't work, or it's not working the way people do, or it's placebo effect. There are a fair number of studies that show that when acupuncture is compared to sham acupuncture, that it doesn't work better than sham acupuncture. So sham is the way that they tested, okay, we'll give this person acupuncture and we'll pretend to give this other person acupuncture, but it won't be acupuncture. Well, how do you do that? It's a procedure, right? Like, how could I give that guy a knee replacement and pretend to give that other guy a knee replacement? You can't do that. I mean, at least not ethically. I suppose you could cut open someone's knee, not do anything, and then tell them you did something, but that'd be pretty messed up and a really unethical way to try something. So that's why medical procedures often don't have double-blind, randomized controlled trials. The RCT, the randomized controlled trial, is something that we developed for pharmaceuticals because the administration of a pill is not a procedure, and we created the placebo, the fake pill, to test whether or not the drugs that I'm giving someone are more or less effective than giving them nothing at all. The difference with procedure is that it's very difficult to show the body, convince the body, quote unquote, trick the body into thinking it got a procedure when it didn't. So in the case of sham acupuncture, some well-meaning researchers designed these little needles that kind of look like those fake stage knives. So like you poke someone and the blade goes down, it's not actually stabbing someone. It's a similar situation. So they placed these sham needles over an acupuncture point, tapped the top, and instead of a needle actually inserting, it just sort of pressed against the skin and no needle was inserted. And then they had the same device, but when they tapped it, the needle actually went in. The problem is that there are whole styles of acupuncture that stimulate acupuncture points at the skin surface. They don't even penetrate. There's Japanese meridian therapies and Korean styles. There's acupressure, where we actually just press the surface of the skin and can elicit or solicit very specific results just by using pressure. So the problem is that the sham tool is not really a sham tool. You're actually just doing a different kind of acupuncture. So the studies that were comparing acupuncture and sham acupuncture were actually comparing conventional insertive acupuncture and surface acupuncture. And what we found was that they performed relatively well compared to each other. Imagine, acupuncture compared to acupuncture, they both did pretty well. What's most compelling, however, is that if we compare the results of acupuncture, sham acupuncture, and no intervention at all, that acupuncture and sham acupuncture perform remarkably better than no intervention, anywhere between 40 and 60% better than no intervention at all. So when that is the comparative structure, you have a much better understanding of whether or not acupuncture is an effective method of dealing with pain. And of course, all of these studies were around pain, because until we can catch more traction in legitimizing Chinese medicine and acupuncture around the use of pain, it's hard to get people to really look at acupuncture for digestive disorder or insomnia or anxiety or any of the other myriad things that we can use Chinese medicine to heal. So all of that's to say, when someone asks me, how does acupuncture work? And I have, an elevator speech's amount of time, so I've got 45 seconds to explain it. I'm always very honest with people. I say, well, biomedically we have a couple of theories, It's not perfectly determined from a biomedical point of view exactly how Chinese medicine works. There's some good guesses. From a Chinese medicine point of view, we have a very detailed explanation, a very thorough, well-tested, clinically assessed and peer-reviewed method of understanding how all of our procedures work. Because I'd like to reiterate, as I've said in many videos, that Chinese medicine is a valuable intervention on so many levels, and the reason that we feel confident in using it is not just because it's old, right? People say, oh, they've been using Chinese medicine for more than 2,000 years. And that's true, but there are things that people have been doing for a really long time that are also invalid. The fact that we've been doing it for a long time itself is not the reason. That over those many thousands of years, doctors who have been practicing the medicine have been writing about their practice of medicine, writing about case studies, writing about specific interventions. And then other doctors, their own peers and contemporaries, have been reading those analyses, commenting on the analyses, pointing out critical error, pointing out critical success, and then having a robust discussion, a contemporary robust discussion about those different procedures. And that those writings have survived to today means that doctors have then commented on the commentaries and then commented on the commentaries of the commentaries and so on, until we get to the modern inheritance of Chinese medicine, which is a thoroughly peer-reviewed clinical practice. We're not just talking about some woo-woo, hippie, energetic, emotional, new age bullshit, right? I'm talking about real medicine, clinically tried and true medicine, based upon the experience of very educated, very capable humans over thousands of years. So we have an explanation for how acupuncture works. It is rooted in Chinese medicine theory, rooted in Chinese medicine diagnostics, and while those diagnostic principles may sound foreign, they may sound different, especially when poorly translated and in the hands of New Age folks, they may sound very soft and fluffy, but that's not what we're talking about in reality. We're talking about real hard-hitting medicine for real conditions that don't rely on your belief. It doesn't rely on a faith-based initiative of some New Age spiritual practice. We're talking about the practical application of real medicine. And so when people ask me, how does acupuncture work? I always, am a little trepidatious about it because I feel like I need these 12 to 15 minutes to thoroughly lay out sort of how it works. What I can say is this: it works well for a host of conditions. The mechanism by which it works is complex and has a variety of points of view from which we can try to explain it. The best thing is, it's safe, it's effective, you should try it, especially in the hands of a licensed acupuncturist who has thorough training, right? Our standard of degree for being a licensed acupuncturist in all states is a master's degree in this subject. We go to school for a very long time. We do a lot of clinical training. We do a lot of analysis of the points. We needle ourselves and each other. So when I talk to you about using this point or that point, or doing this protocol or that protocol, that's based in a very practical set of training parameters that we use to learn that material. So try it out. Get some acupuncture. It's effective. It works. There's a variety of biomedical explanations. There's a detailed and thorough Chinese medicine explanation, and it can help you feel like your best self. Chinese medicine does it better than a lot of other interventions. It can help you feel like your best self, bring you to a sense of wellness and functionality that you might have been missing for a very long time. So give it a try. This is Travis Kern from Root and Branch Chinese Medicine in Portland, Oregon. Check us out on the web at www.rootandbranchpdx.com. Thanks. Have a good one.